Magnolia State Family Medicine, Health Center and Medical Spa, 1009B City Avenue North, Ripley, 587-8176. Call for your appointment. Providing modern medicine with Southern hospitality. That's Magnolia State Family Medicine, 100% veteran-owned and operated. Bethel University Physician Assistant Program affiliated. Magnolia State Family Medicine. Dr. Christopher J.M. Cummins, Medical Doctor. Are 100% employee-owned with friendly service and a fun atmosphere. High quality, low prices. We are Food Giant. Our deli serving breakfast, lunch, supper. Food Giant, 702 Highway 15 North, Ripley. Come shop Food Giant. Want fresh meat and fresh produce? Food Giant's the place. High quality, low prices. Food Giant.
Good evening, Lee Allen Pigram along with Dr. Cummins. This is the Ask Dr. Cummins show. We certainly welcome you tonight. Our phone number is 587-8176. Please give that a call. Now, it's not a live number into the TV station. It does go to Dr. Cummins' office. Please call that number and ask questions. This is your show, a community show. Dr. Cummins has a 30-minute program on every Thursday night at 6:30, and we certainly anticipate and hope that you would call in and participate by asking your questions. Not too big, too small, too smart, too dumb. There's no question. Be complete privacy, and that'll help us. Anything you want to know medically, you can call in and ask, and we'll try to get the questions answered. Good evening, Dr. Cummins.
Good evening.
Did you have a good weekend?
We had a really good weekend, and just glad to be here today.
That's right. Well, I'm gonna tell you what, our weather is really lousy out there. This is Monday. We're taping this on a Monday, and our weather right now is pretty lousy. So
it is.
Let's go right into it. You had mentioned something the other day about some new additions at Rest Haven. I guess you have patients that you. What do? You make rounds at both all three nursing homes? We got threes. What
we have 3 nursing homes here in Ripley, all close to the hospital. One is actually a part of the hospital. I have patients in 2 of the 3 right now and have privileges at all 3. Just haven't. The one in the hospital tends to stay full, and it's probably the most sought after in the community.
I've heard that it's the best one.
And
well,
I
if
think
you want
it's
to
just
use best as an adjective.
Well, it's certainly the most sought after. I've not had a patient there yet, so I can't really comment. But apparently, that's where people, if they can get in there, that's where they want to be.
How large is that? Do you know?
It's smaller than the other 2.
Well, the other 2 are standalone. They have their own buildings.
They're big.
Rest Haven, to my knowledge, Rest Haven was the first one in Ripley back in the 80s, and then. I guess Golden Living. It used to be called
Beverly.
Beverly's
the old name of it.
Yeah. Is it still the name? I know it's called Golden Living.
It's Golden Living, and of course, Golden Living is a big corporation, and they're in several places. As is, I think the folks that own Rest Haven also own Briarcrest in Ashland. So, and I think they're at other places too.
Well, they used to. Now Beverly's a national type deal.
That's right.
Rest Haven at one time was owned by some by physicians that banded together.
Really? I wasn't aware of that. But,
there was 4 or 5 physicians from Holly Springs. In other words, they just kind of banded together and had, like you said, the one in Ashland and one in Ripley, and I think they had one in Holly Springs. But by turning to Golden Living, I bet you, I've heard they've sold out. Whatever. Anyway, we have 3 nice nursing homes in Ripley to pull off of, and it's been my understanding that the one that people want to go to or have first shot at is the one inside the hospital. I think they took a wing, right?
That's correct.
And made it a nursing home. I don't know how many.
And it's been recently renovated. It's in nice shape.
The other 2 are of course, I've mentioned they're standalone. And do you know the size of the other 2? I mean, we're not doing advertising for nursing homes here. I don't know.
I think it's 50 to 75 beds at Rest Haven. I think it's up to 150 or so at Golden Living. Golden Living is certainly the largest nursing home in Ripley.
And of course, they have full staff. So they got to have the whole 9 yards. And I guess you just like you make a round in a hospital, you'll go make a round. If you got 2 patients over at Rest Haven, you'll go make a round over at Rest Haven.
Typically, it averages about once a month that this occurs, that you do your rounds there, and it can be as every other month. It just depends on the needs at the nursing home.
Well, by them being fully staffed, if something critical did come up, of course they have access to your. Yeah.
You know, I'm sure my office, like other offices around town of people that have patients there, we're in constant contact with the nurses there if they have questions and stuff like that. We're almost on a daily basis interacting with the nursing home.
Well, for all you people that have folks in there, and all you people that are thinking about maybe going there, or family members putting somebody there, it's good to know we've got somebody like Dr. Cummins locally that can see to your needs. That's a comforting feeling, I guess, is what I'm trying to say. Like I had a lot of different things that anything at the hospital you might want to mention. We talked about our nursing homes. How about the hospital? They getting staffed up and ramped up and everything?
Well, the hospital's continuing to grow and getting more active, and they have been doing some flu shots this past week, I knew, in the community, and also doing some lung testing, which they're doing with their respiratory department.
Lung testing. What do you mean by that?
Lung function studies.
Let her come on up. We've got a very great surprise guest tonight. This is Sarah Grace Cummins. This is Dr. Cummins' 3-year-old daughter. Look right there at that camera and wave at your mama and your sisters.
Wave at them.
Right there. See that? You see yourself right there on television. But it's been a long time since I spoke 3-year-olds. It is a language. Isn't she pretty, folks?
We're just glad to have her here with us.
Yes, sir. All right, go ahead. I interrupted. I'm sorry.
But anyway, they're doing those things. They're doing that lung testing along with the flu shots and stuff they're doing out in the community.
Now, when you say lung testing, what are they looking for?
Just pulmonary function studies is the fancy word, but just checking lung health and then getting them to the right place, or as in our case, pulmonary rehab. If somebody would need that kind of stuff, they're sending them in that direction. It's just certainly an underdiagnosed problem in the area, and they're just trying to help with that. But also, we should mention that November is National Adoption Month, National Alzheimer's Disease Awareness Month, COPD Awareness Month.
Oh, me, COPD.
They're always coming back.
Yeah.
American Diabetes Month, and I'm not sure why this is the case, but we have a week-long observance of gastroesophageal reflux disease awareness. It lasts a week from the 18th through the 24th.
What is that, reflux?
Reflux.
That's one of my questions. Let me ask that question while you just brought that up.
So it is. They take a whole week to observe that one, which I thought was interesting.
Let's see. Let me find it on my list of things here. All right. This is an older woman. Okay. Now the only way I know to ask these questions, Doc, is to kind of remember how they put it to me. Okay. This is an elderly person. I'd say over 60. A woman. Says she takes her medicine, capsules that she takes when she gets her medicine. She can be going along 30 seconds to a minute later. It's as if the capsule is right here, and that she can, and I use this word, in burp or something like that, and the capsule comes back up. Is that a medical problem? And if so, what type of medical problem is it? And if so, what can be done about it?
Right.
I guess
sometimes our esophagus,
I can get it. Go ahead.
our esophagus doesn't, it constricts, and it does not allow medicine nor food or sometimes even water to advance, or the normal motility, the movement of the esophagus, which is a big muscle that pushes things down into the stomach. And you can have peristalsis, which means it's not moving at all for some reason. You could have had a stroke, and it's called what the nerves that go there to send those messages, it's not working anymore, so it's not getting the message. You can also have strictures or tightening up of that muscle due to scar or things like that that don't let it completely move. A fancy name, the stomach doctors, the gastroenterologists call it achalasia. And there's different parts that are innervated by different nerves, and it does not allow the muscles to constrict as well as they should. There's a wide range of treatment for that. You can even take.
Well, that was my next question. Now, you pointed out what the problem is. Now, what's the solution?
Yeah, and it can range from doing a dilatation. They put it's almost like a big long tube down your throat and stretching out that esophagus to make it more open where you can swallow again. It can also be taking medicines to increase that motility, to make it go back to moving itself again, kind of reforming that memory in the esophagus in its cells to make it move again. And then there's real fancy surgery they get into where they go in and maybe even cut nerves, like a laser surgery type thing, or put new nerves in old places that where maybe your nerves have run out or worn out. And I'm kind of breaking it down.
Right. Well, that's what we want you to do. Break it down.
It's a lot of information back behind there, but it can definitely be treated. And if you're bringing your medicine back up, it's not doing you any good.
Well, not necessarily bringing it back up, but let's just say this 60-year-old or above woman, I'm a 60-year-old male, and I got the problem. I can take something, and it feels like it sticks right here.
Right.
And it feels like it's there. And then I can go 5 minutes or 10 minutes, maybe drink something else, and all of a sudden it's gone. But is it possible for it just to hang there?
It can. It can. Again, if you have strictures or like little scars holding things up, and if you go up high enough to your
Well, now
your
how would you
spots,
get scars?
some people get it from throwing up a lot. A real strong example or severe example of that would be like an alcoholic who has thrown up so many times over their life.
Right.
They end up tearing all the muscles in their throat because it's going the wrong way. And
Could you get it from coughing?
you can get it from like whooping cough. If you didn't have it treated and you just went on and ended up having that, or somebody had acute bronchitis for a long
What
period.
about coughing from COPD?
It could probably contribute to it, but probably have more pulmonary, or your trachea would be involved, not as much as your esophagus. But it wouldn't help. And then if you get high enough to your voice box, where all that kind of meets, the esophagus and the trachea, you can have everything being affected there. And if you're not getting even things past your voice box, because sometimes it can be so swollen, it can't do what it's supposed to do.
Well, I know when I have the problem, there's no pain involved.
Right.
There's no soreness as far as, not like a sore throat. So you just come and get the test, I guess. Right.
That's right. And there's
You of course can do that at your
yeah,
office.
Yeah, we can get everything started. We can't do some of the fancy tests like manometry, is where they actually get you to swallow almost like a little pill. It's electronic, and it goes all the way through testing like your motility and all that kind of stuff.
And you can follow it like a GPS. You can follow it and see if it goes where it's
There's some
supposed
real
to
neat
go.
ways to do it now, man.
Oh, man.
And
Play Nintendo with your throat.
but they can do that now. And but then a real common problem with reflux is just plain old gastroesophageal reflux disease. Sometimes that trap that lets the food in from the esophagus to the stomach stays open. Stomach creates that acid, starts pushing it back up because that trap's not keeping it down.
Right.
Which can also cause things not to enter into the stomach the way it's supposed to. And real simple blood tests can usually detect if you have a problem there or not. We certainly do that in the clinic.
Well, now when you make the comment, and this is one thing I would, as we're talking, when you make the comment, it could have been a stroke. How will you ever know that it's attributed to a stroke?
Sometimes you can do a CAT scan or an MRI of the brain if you start working in that area. and see what part, if there was a stroke, to see what part of the brain was affected by the stroke. And there's certain parts of the brain that are responsible for certain activities in our body. And if you can figure out what that was, it'll point in that direction. A neurologist can be all on top of that heartbeat. And we certainly can.
Okay, so you can point us in the right direction if you couldn't.
Absolutely.
Okay. Well, I'm glad I asked that question. That got into me. Another question, and we'll take this question, Tony, before we go to our broke. But then again, here again, it's the same problem. This older gentleman has COPD, and it seems like food hangs in his throat, and I guess that's the same thing we've kind of been talking about. He says it seems like he can eat cornbread, and it scratches his throat. He's actually had his throat enlarged or expanded. He's had that done, but it comes back, and it's as if he just can't get food down. Is that the same thing we just talked about? Yep. That's a different question.
Right, and another thing I should mention is that what we can do here in Ripley, we use speech therapists to do what we call swallow evaluations. And of course, our nurses in the clinic or the hospital can also do swallow evaluations initially to get them like a preliminary screen. But there's some people that they can't swallow liquids, but they can swallow solids. So that's why you'll hear some people having to eat pureed food, or they have to have liquids that have been thickened.
So they've adjusted their lifestyle down to the problem, right?
Right, because sometimes that's all you can do is treat, to make it easier to eat and drink, but you may not be able to solve the problem, especially if it's secondary to a stroke.
Well, I know this. When something does hang in my throat, and I catch it wrong or I let it catch wrong, then it gets very painful.
Right.
And you can't get anything. You feel like you're suffocating.
Yep, and you can, and then that's why we teach the Heimlich maneuver and that type of stuff.
So I could suffocate.
It's possible.
Well, I mean, it feels like something's coming out of my throat.
Just especially if it goes into the the wrong hole, what we call it.
Yeah,
if it goes into the windpipe, man, you got a problem.
Oh, me. Well, I slid a little bit. Well, that's hitting me right on the nail head there.
Be the bearer of good news.
Well, no, I'm glad to know. You might help somebody, and that's what this show's all about. 587-8176. Make the call. You don't know. He just hit me right on the nail head on one of my many little aches and pains. Tony, I think we'll take our break right now, if you don't mind, and we'll be back right after we hear from our sponsors.
Magnolia State Family Medicine, Health Center and Medical Spa, 1009B City Avenue North, Ripley, 587-8176. Call for your appointment. Providing modern medicine with Southern hospitality. That's Magnolia State Family Medicine, 100% veteran-owned and operated. Bethel University Physician Assistant Program affiliated. Magnolia State Family Medicine. Dr. Christopher J.M. Cummins, Medical Doctor. Fast, hot, and fresh. Open 24 hours just for you. Dodge's Store. Come be our guest. Dodge's Store, Ripley. We are 100% employee-owned with friendly service and a fun atmosphere. High quality, low prices. We are Food Giant. Our deli serving breakfast, lunch, supper. Food Giant, 702 Highway 15 North, Ripley. Come shop Food Giant. Want fresh meat and fresh produce? Food Giant's the place. High quality, low prices. Food Giant.
We're back. Once again, I'd like to say, please call 587-8176. That's the Ask Dr. Cummins telephone number. No question too big, too small. Confidentiality complete. We won't mention any names. And ask your questions. And who knows, you might get an answer, and it might help you on down the road. Well, Dr. Cummins, once again, let's reintroduce Sarah Grace Cummins. This is Dr. Cummins' 3-year.
Hey.
So you want to wave again at Mama and your sisters? There you go. She is very precious, 3-year-old for Dr. Cummins. You've got 2 other children, correct?
Got a little boy and another girl.
What's the age of your?
My oldest girl's 6,
Okay.
and my little boy just turned 2 months today.
2 months today. So you've got 3 and a wife at home, so that's a 4th. These are your better 4ths. What are we gonna call you? This is your better 4th right
Yeah,
there.
she's a good one. And I probably should say too, those questions, not too young or too old questions either for kids or for
That's
adults.
right. Well, here's a question from a 20-year-old. That you mentioned that. This 20-year-old female has had this problem for 5 years, so it started when she was 15. What causes nose? Let me finish the question. What causes nosebleeds? She's had a problem for about 5 years, has absolutely no sinus problems or high blood pressure. But she'll just be sitting there, and all of a sudden her nose will start bleeding, and then after she gets it stopped, she gets a tremendous headache. She gets a tremendous headache. So
Well, I'm not, after it stops, she
after it
gets a headache?
stops, she gets the headache.
Well,
That's right. Go ahead and
Well,
knock off.
the nosebleeds are fairly common, especially with younger people, and most of the time it's just due to rapid blood growth as somebody is growing and getting older, and there's a lot of new vascularity or new blood vessels being made, and it's just being made very fast. And
I understand she's 20. I mean,
Yeah.
because
So-
technically she's still growing.
Oh yeah, and so typically they grow out of that at some point. Certainly by their 30s, if this is still going on, it needs to be worked up further. However, there are other type of things like bleeding disorders, like the different types of hemophilia, and even lesser known but more common bleeding
Now,
disorders.
hemophilia is what they call a free bleeder.
Right.
Okay.
And which used to be what they call the disease of royalty.
Right.
Like, and that was because of it was obviously it's inherited from family members, and the more family members that have it, they can multiply the problem with the kids. But and royalty used to marry close cousins and all that kind of stuff to keep it all in the family. So that's how we started seeing these problems. But these bleeding disorders, if she's got a bleeding disorder,
Yes or no? She
Right.
says she'll just be sitting there, any time of day, anything, and all of a sudden her nose will just start bleeding, and it'll bleed for a few minutes. She'll get it stopped, and then she'll get a pretty bad headache.
Right.
And she checked. She has no sinus problems, and no no high blood pressure, anything of that
I
nature.
can tell you, if she were to go to a provider, a physician's going to start by checking her, to see if she's anemic or not, and also going to check to see if she has any of those known bleeding disorders. You always want to rule out the worst things that can cause somebody to die, and that's kind of where physicians go, want to rule out those big problems. Sometimes by just taking a good history, like we talked in a previous episode, taking a good history, we can rule out some of those big problems without a lot of expensive tests or anything. But nosebleeds are common, and they certainly can be treated. Now, one thing is you want to apply pressure. If you have a nosebleed that starts, you want to. It's kind of hard to visualize this, but you want to have gauze or whatnot with continual pressure, and you want to leave it there for quite a period of time, not leave it a few minutes and then go back and check. A lot of times curiosity gets the cat, and then we start bleeding again. You want to give your time for your blood to clot, 5-10 minutes of good gauze in the nose and pressure, and don't let curiosity get that cat and go back and start checking, because you'll keep bleeding, because you'll keep dislodging the clot is what's happening. But nosebleeds happen a lot.
Well,
Most of the time it's not a bad thing, but
Or it's not a life-threatening thing.
that's
but-
correct.
But I would say if it persists, you do have ways of checking that out for them, and you do have ways to maybe offer some suggestions to make a little bit more compatible.
That's correct. And if she's getting headaches, that does make it makes me worry as a physician if she is getting
Headaches from that.
volume depleted, her blood volume is going lower than it needs to. You know, I would wonder if she's having heavy menstrual cycles also, which can also attribute to making a woman become anemic
Right.
and things like that. So a
Now,
really
when
good
you say
history.
heavy, you're talking about bleeding more than normal, I guess.
Than
but
the
I mean,
average female, correct.
Okay.
I mean, even the average menstrual cycle makes a woman a lot more likely to get anemia than a man,
Well, of course, they lose.
and
yeah.
to get iron deficient.
Right.
So all that stuff has to be, it's the whole body.
Yeah.
And man, you just really, but a good history can sure
That
help.
may be why they give pregnant women, they let them take a lot of iron.
That's right.
I mean, is that the reason?
That's right.
That we
That's
just
got a lot to
okay,
do with
I
it.
didn't know that. That's two things I learned today.
Yeah,
I didn't
yeah.
know that.
Yeah.
Not a great big highlight of my wanderings, but I mean,
Yeah,
well,
but-
that's good.
but iron's way. It's men usually keep it in their diet, and we don't go through those having children and the menstrual cycle. So it's more rare for us to be iron deficient.
Yeah. Okay. Well, let me get to this next question, and I guess we could do a whole show on it. But it was asked, and I figured it would be. It's kind of a common problem that people have, especially people that work in. It seems to be working people that work maybe on an assembly line or have some type of continuous operation on the hands and wrists. Carpal tunnels. Tell me about carpal tunnels. Does wearing a brace or a wrist can that cause carpal tunnels? And the older people thinks the way she said it, it says wearing a brace or wrist strap can cause weak wrist. Would that cause a weak wrist, and would that lead to carpal tunnels? Wearing a strap or a wrist thing. That's an older person asking that
And
question.
they're half right about that. And what I mean by that is if you wear these splints that we typically use at night to help treat carpal tunnel syndrome, the pain of the wrist, if you theoretically were to always have it splinted and never use it, your muscles would atrophy, and you would have less use of your wrist, and you would have less range of motion
And
of your
naturally, it would
wrist.
be weaker.
Correct.
if you're not
So
using
she's
it.
right about that. But using it at nighttime when you're typically not using your wrist anyway or your musculature to help put your body in a good anatomical position to help prevent the pain of carpal tunnel syndrome and keep that tunnel open, if you will. That's been proven to be very efficacious or very successful in treating that pain. Almost just as effective as taking medicine for it. So I wouldn't say don't use your splint. I mean, you need to use your splint at nighttime, but you do need to take it off and resume regular activity during the day as much as possible.
Well, of course, carpal tunnel surgery is very common,
Yep.
And that seems to be, quote, you hear of, I know every year you'll hear of 2 or 3 of your friends having that type of surgery every year, and most of the time it's attributed to the fact that that person has worked, let's say, at a furniture factory or something of that nature with a repetitive action.
Right.
And carpal tunnel surgery doesn't necessarily mean that once you have the surgery, the problem's over with forever, right?
No, it can certainly theoretically come back. I've got 2 cousins that are physicians. One's an orthopedist and a bone doctor, and another that's an ophthalmologist and eye surgeon. And they both were discussing a couple weekends ago. We were together, and they both have had to have, at this point in their lives, they're in their mid-50s, had to have carpal tunnel surgery to continue to be able to do the fine surgery that
They're
they've
trained,
been doing, because they were having numbness from having having that carpal tunnel so bad. But now they're back in the operating room, no
After
problems.
having the surgery.
And they're doing great.
Well, I mean, it hits. I wasn't picking on the furniture man there. I mean, it hits that way.
Yeah,
He says we got a couple of minutes left, so I don't guess I've got some more questions we had. I didn't get to ask all of them, but I guess we'll kind of wind her down. Is there anything you'd like for Sarah Grace? Would you like to wave to your mama and your little sister and your little brother and your big sister again on television?
So, hey,
You see yourself right there? You're right, you see? Isn't she precious at 3 years old?
well, I know tonight we have our medical staff meeting. It's a quarterly meeting coming up. And we ask everybody to keep prayers for the hospital, and we find ways to do better and serve y'all in the community. And even if you don't have a question here, if you have a statement or a comment about the hospital or about my clinic or things we can do better,
Let us
Call
know.
in, let us know.
That
And,
587-8176 is for y'all, and use it. That's what he's trying to tell you. So anyway, we'll, with that, no more being said, we'll wait, again till next week. Please call in 587-8176 and give us your questions and let us know what you're thinking. And we'll see you again next week. Good night.